Do you think drugs like Ozempic, Zepbound can help prevent cancer? Researchers are actively studying whether the medicines can lower obesity-related cancer risk, which it looks like they do, improve cancer outcomes, reduce complications during treatment. And there's been some evidence to suggest all of those. So that's why oncology researchers are kind of paying close attention, and there are several studies that are upcoming about this. Obesity increases the risk of at least 13 cancers, and we've seen this with prior studies. Some lab studies even suggest there's possible anti-tumor effects with GLP-1 through like mTOR pathways. But an important point, we still do not know how much of the benefit is derived from weight loss versus the direct drug effects. That's, of course, much harder to pair out. So what trials are happening now? Most of the current studies with GLP-1 and cancer are small phase 2 pilot studies. And there's some areas that are being studied. Endometrial pre-cancer and early fertility-sparing cancer. Researchers testing GLP-1 in combination with progesterone IUDs in women with obesity-related endometrial disease. Rectal cancer is another area. Trials are investigating whether metabolic health during chemotherapy improves tumor response and surgical outcomes. So that's very interesting. Prostate cancer during hormone therapy, because androgen deprivation causes weight gain and insulin resistance and cardiovascular risk. Investigators are looking at semaglutide to see if that can help outcomes. So right now, these are early stage studies. This is not definite proof. So these studies that have been published so far are observational. They're large observational studies, and that is exciting, but remember, they're just observational. So in these studies, some database studies like this have shown lower obesity-related cancer incidence with GLP-1, lower mortality in patients with diabetes and cancer who take GLP-1, lower liver cancer, better cardiovascular outcomes during cancer treatment. That makes sense. But observational studies cannot prove causation. So, and people who take GLP-1 drugs may differ in many ways from people who are not taking it. And that's why you can never say that that's causation. So that's why randomized prospective clinical trials matter, because that can show causation, and none have been published so far. Why is cancer prevention so hard in a trial? This is what most people often don't realize. To prove cancer prevention scientifically, researchers often need over 7,000 patients, over 10 years of follow-up, which is an enormous amount of funding, and of course, ethically designed studies, because cancer develops slowly. And now that GLP-1 medicines are already approved and we've known to improve diabetes and cardiovascular disease, so giving placebo for a decade, that's ethically very difficult. So this is what researchers are calling is one of the biggest logistical challenges to this preventative research. What do I think is the most promising area? Probably the low-hanging fruit, like fatty liver disease and liver cancer prevention, because fatty liver can cause fibrosis, which can cause cirrhosis, which can cause liver cancer. GLP meds clearly improve fatty liver disease in great prospective randomized trials. Caution, I think, in all of this excitement is that we're still in the hypothesis generating phase. There is no currently FDA-approved GLP-1 for cancer prevention. There is no definite randomized trial proving causation, and there are no recommendations to use GLP-1 medicine solely to prevent cancer. So the science is exciting, but it's still evolving.